I have to say that although great achievement has been made in regards to the oocyte quality or the egg quality, all the factors that may influence the quality, we still, doctors, we don't know everything about them. We can separate the factors that may influence the oocyte quality in two. We can separate them as internal ones and external ones. So the internal factors will be all of those that we do not have control of them. For example, for instance, can be the age, can be the genetic, can be the endometriosis or the PCOS, which are chronic illnesses. So, for example, the internal factors, the age probably is one of the most important ones. And the reason is clear. The younger we are, the best quality we're going to have. And this goes, of course, also for female. The younger they are, the better quality the eggs are as well. So there is a fact that can demonstrate what I'm saying, and of course will be the miscarriage rate. For instance, for a patient who is 29 years old or under 30 years old, the chances of having a miscarriage is going to be around 10 to 15%. Whereas on the other hand, if we have a patient over 40 years old, the chances of having a miscarriage will be 25 to 33%. So that's what I said that I have to say about the age. I also spoke about genetic. Genetic, we don't have any control about that, as you know. And of course, genetic is really, really strongly influencing the fertility for a patient. It's also influencing the fertility and the menopausal period for a patient as well. And of course, although we cannot do anything about this, at least we can have a backup plan, and we can advise our patients, and we can advise female. And then we have the endometriosis and we have the PCOS. Both are chronic illnesses. The endometriosis, as you know, is increasing the oxidative stress. So, of course, it is affecting the microenvironment of the ovary and therefore is affecting the egg quality. Endometriosis also has a negative impact in terms of the ovarian reserve. In regards to the PCOS or polycystic ovarian syndrome, what we know is that it's causing an imbalance between the hormones, and for that reason also is changing the microenvironment of the ovary, and also is harming the quality of the eggs. So those that I mentioned will be the most important, and those are the internal factors. As I said, we cannot do too much about them. But we have other ones, and those are the external factors. And in those external factors, I want to talk about the lifestyle factors. I want to talk about the environmental factors and occupational factors. So for these three, the most important will be the lifestyle factors. So what I'm saying lifestyle factors, I'm talking about smoking, alcohol, overweight. Those are the three main. Those factors, I have to say that we can change them and we can modify or fix that lifestyle factors, but not always that we are doing this, or not because we are changing or modifying this factor that is going to mean 100% that we're going to improve the quality of the egg. So mainly will be to modify or change those factors, not to harm the egg, but not because we are improving those, that means that we are necessarily to improve the quality of the egg. About this, also we can mention the coffee, the caffeine, and here there is a little bit of controversy about the caffeine, where some people is thinking that it's not affecting anything, other people is thinking that it's going to affect lots, the caffeine. My opinion about the caffeine will be that if you are having a regular intake of caffeine, but no more than 4 cups a day, a week, sorry, it's still fine. But over this, it can negatively impact the quality of the egg. So then the bottom line of this, the internal factors, as I said, the most important one will be the age. And overall seems to be that can be the factor that most can influence the quality of the egg.